Today we're talking about the General Hepatology Update session that's coming up. I'm joined by Dr. Firpi and Dr. Nguyen. Thank you for joining us today. So tell me a little bit about the purpose of the General Hepatology Update and how did you pick the issues that you're going to be covering there?
The General Hepatology Update is probably one of the most well-attended sections of the entire liver meeting. People love these sections because we take three hot topics of very difficult to manage issues in hepatology, and we discuss not only what is all about this topic, but how to diagnose the patient, how to treat the patient, and what is new in the horizon. So we hope that people can take at least 2-3 points and take that away to their practices, whether it is academic or private practice, and take that to the patient.
Dr. Nguyen, what are your hopes? What do you want people to come away with after attending the General Hepatology session?
I hope that the attendees can learn the most updates on how to select patients for alcoholic liver diseases. So we have a lot of issues with prioritization in the recent years, and really how to utilize the resources, the precious organs best. And there have been a lot of updates and recent advances in helping us on how to best select the patients.
What are some challenges that doctors face when selecting patients for liver transplantation?
Wow, there are actually many issues that we actually face every day. And I think the more pressing one would be donor liver allocation. So that's been a problem all over the years. And for example, you can have a patient in the West Coast with the same MELD score that somebody in the South. And the person in the South probably will get a transplant faster than somebody in the West Coast. So UNOS is trying to change the policies, for example, with the new MELD 35 sharing system, to try to prioritize patients based mainly on MELD score, no matter where the region is. Also, I think the cost of health insurance, that would be very important, and more the cost prohibited immunosuppressants in patients after transplant. You can get a transplant, but what's going to happen after transplant if you don't have the resources to pay for that immunosuppressants?
Dr. Nguyen, what do you think hepatologists need to know about venous outflow disorders?
I think in the old days, or the traditional names of it, is just the obstruction in the hepatic venous system. But actually this system is quote-unquote outflow, so it can range anywhere from the interhepatic smallest vessels of venules on the way down to outside to the inferior vena cava. So I think that we need to think about it more on physiologic terms, not just blood clots in the hepatic veins, and more importantly, the underlying causes of this, because some of that can be modifiable, or some of that can be quite grave, like cancer. And then management also can be challenging because it really has a very varied etiology. So the management can be optimized depending on what the underlying condition is.
You know, one of the biggest challenges that hepatologists face is, dealing with acute liver failure. What do you think you can do in this session to help doctors better diagnose and evaluate the acute liver failure patient?
It's an important topic. I think the issue with acute liver failure, it depends on the cause of this acute liver failure. You can go from a simple, Tylenol intoxication, acetaminophen intoxication, that it could be treatable, to cases that we don't know the cause of the acute liver failure. And I think the most important is to recognize, or early recognize, patients that will need a liver transplant. Who needs a transplant? Who needs to be transferred to a center for tertiary care so they can get a transplant soon? And so I think that's very important.
Well, thank you guys so much for being here. I know that everyone's going to be very excited about attending the General Hepatology session tomorrow. Thank you again for joining us.
Thank you.
Thank you.